The Democratic Nursing Organization of South Africa, that's Denosa, it has warned of rolling mass action if outstanding salaries are not paid this week. Trainee nurses in Gauteng haven't been paid for several months now. Joining me for this conversation is the Gauteng Health Deputy Director General for the Corporate Services, Basani Baloyi. Ms. Baloyi, thank you very much for your time. Please give us your answer as to why these trainee nurses have not been paid.
Good morning, Toli, and the Newzroom Afrika viewers. Yes, it's true that, the nurses have not been paid, and this is due to the challenges that we are facing as a department. And when you look into what Denosa has said, we really apologize for what has happened, and we have since addressed the challenges. And
these nurses, we understand, it's not 1 month that they've missed, Ms. Baloyi. It's several months. You speak as if this is something that was a systems glitch at the end of this month. This has been going on for some time, so you have been fully aware of what's going on. Why are you not sorting it out?
Toli, this has not been only the systems glitch, but we also had budget, challenges. And when we looked into these issues, we needed to resolve it. And unfortunately, is the challenges that we faced, we could not deal with them, timeously, because now we had the 2021 cohort that concluded, their community service by end of March. And unfortunately, when we had to deal with the 2022 cohort, that, also exacerbated the challenges, because of the 2021 cohort should have vacated, the positions that are supposed to be filled with the current cohort. And also to clarify the matter is, when you look into these nurses, I think this is a challenge that has been there for the past 5 years. And Denosa has got, all the rights to respond the way they responded, because of it's an annual problem. And in some instances, when one looks into how it has been, addressed, it was just a short-term measure. But I think now we are faced with, an opportunity to look into a long-term measure in terms of resolving this issue.
These are nurses, Ms. Baloyi, that are desperately needed by the public health system. And that information, it's almost second-hand information given what happened during the COVID-19 pandemic. We saw just how weak our public health system is. Why would you cut your nose to spite your face, so to speak, as some people would say, because you are a health system that's already on its knees? Why would you do that to not, I suppose, prejudice someone like yourself who's in a better position to have a medical aid? But what you are doing is you're prejudicing the people who depend on the public service, who don't have medical aid. Those are the people that you are saying, go to the public health system and you get your leg amputated, even though you had come in for a headache.
Toli, what I would say is, when you look into how we've dealt with this matter is, we've got a high demand of nurses in our system, which is something that we cannot hide behind. But on the other hand is, we are training more nurses that we could accommodate in our system. Because of these are also the nurses that are not coming from somewhere else, but these are the nurses that we have invested in terms of training, because of the training that they've received, has been funded by the department. So at this particular point in time, our supply and demand also does not talk to, our budget allocation. So that is the biggest challenge that we are trying to address in terms of how do we deal with this matter, looking for a long-lasting solution, because we need to review the model in how we deal with the nursing profession. And it's not only these nurses, we are also facing, the scarcity of skills in various occupational categories of nurses, especially, specialized categories. So what we have been doing in the past, it's a model that is not sustainable. So now we are busy cleaning the system. We are busy looking into, the model that will not land us in the same situation in the next financial year. Yes, we've got, positions that are available, but, the budget and the planning processes does not speak to what, we're envisaging. And I'm not trying to defend this situation, but it's something that we need to be looking at. And this is what is happening only in the Gauteng province, not only in other provinces.
Yeah. So let's sum this up then, Ms. Baloyi. When can these trainee nurses get their monies? And is that going to be backdated for the months that they have not received their salary or stipend?
They will be paid by the end of this week. And they've started, what we have established is that, from today they will be paid, and they will definitely be back paid, yes.
Okay, all right. At least that's comforting, because you will know that when this strike does happen, it is going to prejudice the very members of the public I spoke about a little earlier. But let's turn our attention to the other story that has been quite topical in the province of Gauteng. I'd like to talk to you about the CEO of the Rahima Musa Mother and Child Hospital. That's CEO Newzroom Afrika. Is she still working from home?
No, she has never worked from home. Dr. Mkabai has been on sick leave, and according to what I know is that she's back in the office today.
Sick leave for how long, ma'am?
She has been on sick leave for almost 2 weeks, and then she's back now in the office.
And within that 2 weeks, she was fit enough to suspend a whistleblower who basically sought to tell the public about the dire state of the hospital she runs.
No, the suspension happened before she went on sick leave.
Okay. And have you found out from her why she suspended this doctor in the first place?
We are currently we have actually established facts, because she did not suspend and went on sick leave. If you remember quite well, Dr. Dimaya was suspended on the 9th, and on the 10th at 9 o'clock, the MEC and I and other colleagues were at Rahima Musa to establish what really happened.
Are you satisfied with her performance at that hospital?
I would not say that, it's regarding the performance, but what I could say, Chloe, is that that hospital has got a lot of challenges. Some are administrative in nature, some are actually, clinical. And we have, since, asked the team to work on a plan that will address all the issues, including those that are related to human resources management and finance, as well as the general administration.
And so in your response, what I surmise is that you are satisfied with the manner in which she is managing that hospital.
No, we are not satisfied. We also working on, interventions that will ensure that, all these challenges are addressed. So I cannot say that we are satisfied. However, as I said, she has been on leave and will give an opportunity to respond to some of the major issues that are related, to the administration of the hospital.
If she was not working from home, why would the Portfolio Committee of Health, these are members from National Parliament who have seen it fit to come down and actually see for themselves what's going on at Dr. Rahima Musa Hospital, why would they then ask the Health Ombudsman to investigate why the CEO of this hospital has been working from home?
So we have dealt with that matter because we asked the CEO if she was working from home, and what we established was that it was not on daily basis that she was working from home. It was at the peak of COVID, and when we intervened, she was directed, to be working from the office, and that is a matter that has been resolved some 2 months ago. So as far as you are concerned, the CEO is working from office, unless if there is new information that has not been brought to our attention.
Yeah. Are you going to
But
listen?
when that was brought to the attention of administration, Dr. Mkabai was directed to be, to work from the hospital, not from home.
Yeah. Well, you will know, Ms. Baloyi, that the Tim de Meer issue, that doctor who was suspended by her, that wasn't the first issue with this hospital. What is your response as people who are in charge of the health system in Gauteng? What's your response to people who are saying that this CEO is arrogant, she's underperforming, and she should be chucked out?
Tolu, what I can say is that matter is now, within my office, and we're currently dealing with all those issues that, have been raised, and will respond accordingly. I think it will be premature for now to respond to that, but those are the issues that, my office is currently attending to.
All right. Thank you very much for your time. That's the Gauteng Health Deputy Director General for Corporate Services, Basani Baloyi.